Hi, it's Dr. Mahadevan, and we're going to continue our discussion of basic life support and airway management with part 4 in our series. And as I mentioned in the last lecture, when we're providing ventilation, there are 3 very important elements: open the airway, insert an airway adjunct, and then provide rescue breathing, typically with a bag mask device. This lecture, we're going to focus on providing rescue breathing. So when we're providing rescue breathing, it's very important that we give 2 rescue breaths to make the chest rise, and that each of these rescue breaths is given over 1 second. The compression to ventilation ratio, if the patient does not have a pulse, is 30 compressions to 2 ventilations. And that consists of 1 cycle. And remember, if the patient doesn't have a pulse, we're going to do 5 cycles every 2 minutes before we reassess the patient. How do I give rescue breaths? If you are in the pre-hospital setting and don't have access to a bag mask device, you may be giving mouth-to-mask ventilation where you yourself are breathing for the patient. We know that room air has 21% oxygen, but when you're breathing for the patient, your exhaled air only has 15% oxygen. So you're basically breathing that exhaled air and providing ventilations for the patient, and then the patient is going to breathe out through a side port. I only recommend using this approach when other ventilation devices, such as a bag mask device, are not available. More commonly in the hospital or pre-hospital setting, you're going to use a bag valve mask device and provide bag mask ventilation. When you only have one person, one of your hands is going to be used to squeeze the bag and provide ventilations. The other hand is responsible for holding the mask onto the patient's face. And as I mentioned before, when you have one hand dedicated to trying to hold the mask on the face, we can use the EC technique to hold it on there. But this can be very difficult, and it's hard to keep a mask seal. So the toughest part of one-person bag mask ventilation or bag mask ventilation is maintaining that mask seal. So when you have providers, it's always better to have 2 people provide bag mask ventilation. So one person's job is only to squeeze the bag at the appropriate rate and the appropriate volume. The other person's responsibility is to really hold the mask on the patient's face and provide a good mask seal with both hands. And in doing so, this is the preferred technique when you have at least 2 providers available. Again, when we're talking about ventilation guidelines, remember to deliver each breath over 1 second. You want to give just enough air to make the chest visibly rise, and that's usually about 500 to 600 milliliters of air, about half the bag, half of a 1-liter bag. And it's very important not to squeeze rapidly. Avoid rapid, forceful breaths because this tends to force air into the stomach and less air into the lungs. And following all 3 of these steps is really important because it'll reduce gastric distension and reduce the risk of passive regurgitation and aspiration. So how does this look again? You're going to get the appropriate mask size, place it on the patient's face, and then you're going to really push down on the mask and make a good seal, open the airway, and then your second provider is responsible for providing ventilations or squeezing the bag. Remember again, in the average adult, you're going to give anywhere from 500 to 600 milliliters of air with each breath, or about half of that 1-liter bag. How do you know that your bag mask ventilation is working? You want to look for clinical signs that the patient is improving. So you'll see that the chest rises and falls with ventilation, that if the patient has a heart rate, that the heart rate tends to improve. And then finally, if you have oxygen saturation monitoring, you'll see the saturation come up, and usually the patient's color should improve as well. In summary, when providing ventilation, there are 3 key steps. The first step is to open the airway. Step number 2 is to insert an airway adjunct, and that can either be an oropharyngeal airway or a nasopharyngeal airway. And then the final step is to provide rescue breathing, and this can be done with either a mouth-to-mask device, or if available, you're going to use a bag mask device to provide bag mask ventilation. In summary, with regards to basic life support and airway management, regardless of whether a pulse is either present or absent, it's very important to know how to provide ventilation. It's part of both pathways, and it can save someone's life. Thank you for your attention.